Abdominal swelling. The abdomen is between the chest and the pelvis. It can be because of the build-up of excess fat by obesity. It can be because of growth of a uterus during pregnancy. And it can be sometimes because temporary retention of water shortly before menstruation. It can be ascites. There is when water between the two layers of peritoneum covering the inside of the abdomen. That can be cause metastasis or secondary growth of cancer had grown in the peritoneum, or something else with the kidneys or the liver or heart, probably. And it can be because of ovarian cyst or intestinal obstruction. And there can be made abdominal x-rays and ultrasound scanning and laparotomy and laparoscopy. And that's according to the Illustrated Medical Dictionary written by Sue Davidson, Penny Preston, and Francis Williams on the pages 4 and 5. But this is no substitute for medical knowledge and also no medical advice. Hi and welcome. I'm trying to learn medicine today, abdominal swelling, and after we've done that, we're going to do stretching. And if you participate in the stretching, then it's better your own risk, and we're going to talk about internal anatomy and so on. I haven't read it. And this is no medical advice, I'm just trying to read and to understand it. Abdominal swelling. Enlargement of the abdomen. Okay, that makes sense, the abdomen is bigger. And the abdomen is the part from the chest to the pelvic. Abdominal swelling is a natural result of obesity and growth of the uterus during pregnancy. Obesity has an entry. Obesity, a condition in which excess fat has accumulated in the body. A person 20% above the recommended weight for his or her height is obese rather than overweight. About 2 in 5 people in the United Kingdom are overweight, and 1 in 5 obese. This book is from the early 2000s, I think. Okay, obesity is excess fat has accumulated in the body. And also during pregnancy. Growth of a uterus during pregnancy. Wind in the stomach or intestine may cause uncomfortable bloating, distension of the abdomen. So I don't think let's look if I have an entry. Wind. A common name for gas in the gastrointestinal tract which may be expelled through the mouth, see belching, or passing through the, I can't say the word here, see flatus. Babies often swallow air during feeding, which, unless the baby is winded, can accumulate in the stomach and cause discomfort. So it's gas in the gastrointestinal tract which can be passed out through belching and flatus. And so wind in the stomach or intestine may cause uncomfortable bloating, distension of the abdomen. Some women experience abdominal distension. I don't know what distension means. I knew it previously not. It's normal word, no? So I got it up here. Okay, some women experience abdominal distension due to temporary water retention just before menstruation. Okay, abdominal distension because of temporary water retention shortly before menstruation. Other causes may be more serious. Okay, these were not the serious causes, not serious. For instance, ascites, accumulation of fluid between organs, may be a symptom of cancer or disease of the heart, kidneys or liver. Okay, ascites, let's take a look there. Ascites, excess fluid in the peritoneal cavity. the space between the two-layer membrane that lines the inside of the abdominal wall and which covers the abdominal organs. So fluids inside the two-layered peritoneum. Ascites may occur in any condition that causes generalized edema, such as congestive heart failure, nephrotic syndrome, or cirrhosis of the liver. Ascites may occur in cancer if metastases, secondary growths from the cancer, aids when the body develops in the peritoneum. The condition also occurs if tuberculosis affects the abdomen. Ascites causes abdominal swelling and discomfort. It may cause breathing difficulty due to pressure on the diaphragm. The underlying cause is treated if possible. Diuretic drugs, particularly spironolactone, are often used to treat ascites associated with cirrhosis. Was here ascites, accumulation of fluid between organs, may be a symptom of cancer or disease of the heart. Excess fluid between the two layers of a peritoneum covering the inside of the abdomen. May occur in cancer if metastases from a cancer elsewhere in the body develop in the peritoneum. The metastases are if the metastases are growing in the peritoneum itself. And the other thing are part of other things. It can be an indicator, it can be a symptom of cancer when metastases there, but also disease of heart, kidneys, or liver. Swelling may also be due to intestinal obstruction. See intestine obstruction or an ovarian cyst. It can be because of obstruction of the intestine or an ovarian cyst. Diagnosis of the underlying cause may involve abdominal x-rays, ultrasound scanning, laparotomy or laparoscopy. In ascites, some fluid between organs may be drained for examination. Okay, abdominal swelling. Can I say it all? It can be excess fat deposited there, or during pregnancy, or growing of a uterus because of or during pregnancy. It can be a temporary water retention shortly before the menstruation, and ascites, water between the two layers, or here between the organs. Between the two-layer peritoneum can be a symptom of cancer, metastasis in the peritoneum, or of heart, kidney, liver. Heart, kidney, liver. And it can be also intestinal obstruction. There can be done abdominal x-rays, ultrasound scanning, and so on, and laparotomy and laparoscopy. Abdominal x-rays, ultrasound, laparotomy, laparoscopy. Let's try it. Let's look if I'm able to say 90%. I'm going to start saying it. Abdominal swelling. The abdomen is between the chest and the pelvis. It can be because of the build-up of excess fat by obesity. It can be because of growth of a uterus during pregnancy. And it can be sometimes because temporary retention of water shortly before menstruation. It can be ascites. There is when water between the two layers of peritoneum covering the inside of the abdomen. That can be cause metastasis or secondary growth of cancer, had grown in the peritoneum, or something else with the kidneys or the liver or heart, probably. And it can be because of the ovarian cyst or intestinal obstruction. And there can be made abdominal x-rays and ultrasound scanning and laparotomy and laparoscopy. And that's according to the Illustrated Medical Dictionary written by Sue Davidson, Penny Preston, and Francis Williams on the pages 4 and 5. But this is no substitute for medical knowledge and also no medical advice. I'm going to start again. And that was the medical part. I don't know if I should say that, but I'm not naming Dr. Sue Davidson, Dr. Penny Preston, and Dr. Francis Williams with a doctor title because I don't want to give indication that this is written by doctor. But it is written by doctor's book. If you were here for medical medicine, you can go directly to the next part of medicine. If you stay here and participate in the stretching and the the feet are staying together, on the toes and the other toes. Here, here. And again in, toes, toes. This time stay down in the knees. And up again. And a bit to the sides, very in the arms up. Out, go to the side. Again in. Out to the other side. In. Out the arms down. One hand slides down the leg. Breathe in. Out one arm over. Breathe in out the rib cage. Out and back. Again in. Out one hand slides down the leg, the upper shoulder stays down. Again in. Out one arm over. Breathe in and out the rib cage. And out. Have your feet standing together. Breathe in the arms up. Out one hand down and reach. In and up. Out the other. In and up. Out and down. Shoulder width wide apart with the legs and shoulder circles back. Up in front. And backwards. And breathe in the shoulders up. Breathe out. In and up. And in the arms up. And reach all this with one hand high up. Pretend to take an apple hanging high on an apple branch. The turn is a bit around. And then to the bit out. And wide apart with the legs, the arms to the side, breathe in. And out, go over to one side. Again in. And out. In. And out, lean into the knees, breathe in. And out, one shoulder in front. In and back. Out the other one in front. In and back. And out and hanging down. Breathe in. And out, one leg over. Again in. Out to the other side. In. Out into the middle. And close the feet, but keep on hanging down and breathe. And out. Again in. And out goes slowly around back up again to the backwards. Toes are pointing to the outside, breathe in the arms up. And breathe out and sink down, elbows against the insides of the knees. Breathe in and straighten up. And out and come to the back up. Again in. And out. Down. Breathe in, straighten up. And out comes slowly in one straight line upwards. And the hands get down. Stand good on one leg, the other heel on top of the knee. Breathe in. And if you can do it without to injure yourself, sink down. And other leg, heel on top of the knee. Breathe in. And out. Legs to the sides, breathe in and out. And out. In and up, stay up. And out. In and up. out. Breathe in across the legs. And breathe again out. It was stretching. Thank you very much. And until next time.